Appreciate you jumping on. And it's 7:02, so I'll go ahead and get us started. Everybody, welcome. And for anyone who's going to jump on and is watching this recording in the future, my name is Freddie Corona. I'm one of the business development representatives for Vitality Weight Loss, led by the one and only Dr. Peter DeBry. We're very grateful for everyone's presence here today and everyone's interest in this amazing new opportunity that Medicare is bringing out. And we're grateful that among many other people who probably don't even know about this, we are a hub where we can give out this free information as a service to our community, because ultimately that's what we're about, helping our people get in shape and find the real, true sustainability of health in their lives. So without further ado, I want to thank everyone for jumping on. Betty, thank you for jumping on. Delina, Anna, and anyone else who will jump on in the future. And if you're watching this also on a video recording, thank you so much. I want to remind you, you can always go to vitalityweightloss.health and see our whole value proposition there. You can email me there. There's an info@vitality.academies.health, or my own email as well. I'll put it in the chat box right now. I'm always available for any questions that anyone might have. So without further ado, I'd like to introduce the man of the hour, Dr. DeBry himself. Dr. Peter DeBry, thank you so much for joining us, sir. I appreciate you. The floor is yours. Thank you very much.
Great. Thank you, Freddie. Thank you so much for helping set this up.
My pleasure.
What we are talking about here is something absolutely revolutionary. This is like man walking on the moon. It really is incredible. And so we're going to share some highlights about Medicare and their willingness to help cover weight loss meds. And I just want to introduce a little bit about Vitality Weight Loss. So as a physician in Las Vegas, for years and years, I would see patients struggle with weight loss. And finally, I realized that they need not just a clinic, but they need a plan, and they need comprehensive care where fitness, diet, nutrition, psychology, all these things work together to help the patients to lose weight. And now, along with GLP-1 medications, we offer a program that is extremely successful for long-term weight loss. So in the patients that I take care of, many of them have Medicare. And one of the biggest frustrations has been that the government created laws that Medicare could not pay for weight loss medications. Now, over time, it became very apparent that GLP-1 medications are extremely helpful for weight loss, but along with that, they decrease the risks of other diseases leading to medical problems. For example, uncontrolled diabetes is dramatically improved with the weight loss associated with GLP medications. Cardiac risks of heart attack are greatly reduced when people lose weight because of GLP-1 medications. Sleep apnea is another one where a lot of the symptoms can completely go away when patients lose weight associated with GLP-1 medications. So we know through multiple studies that life is better when you're more healthy because of weight loss. And finally, Medicare recognized this and passed a kind of a short-term spending bill to allow them to have this bridge program that we're going to talk about. So this is exciting, groundbreaking news. So the medicines, the best thing about these medications is it's the official name brand medications that we're looking at. So like Wegovy, Zepbound, that would be semaglutide or tirzepatide. And in the past, because they're name brand medications, if you had to pay for them out of pocket, this could be $400 or $500 or $600 per month, which a lot of Medicare patients are on fixed budgets, and those numbers are just not possible for a lot of people. So being able to open up the window and allow these medications at a cheaper price point is going to allow many, many, many more people into this category. So the Bridge program, and the reason why it's called Bridge is because it's leading from where we are now, which is basically zero coverage, and it's leading us to probably a future day when Medicare will have a full program that continuously covers this. But for now, this is a bridge to get us from one to the other. And this is starting July 1st. And so there's going to be a lot of people out there, when they hear about this and recognize it, they're going to want to be on this program ASAP. Now, July 1st is only what, a few weeks, well, 1 week away, right?
What a week, yes.
We're up against a 1 week window here where clients are going to be very interested. But what I anticipate is this whole summer, as Medicare patients find out about this, they're going to want to get enrolled so that they can have access to this $50 per month program. There's also a third medicine called FundaYo. FundaYo just came available, and one nice thing about that one is it's an oral GLP-1 medication. So we have Wegovy, Zepbound, and FundaYo, and all of these are going to be available at that $50 per month price point. So who qualifies for this? So you have to have Medicare, obviously, but along with that, you have to have a Medicare Advantage plan that includes the prescription medicines, or a Part D plan. Number two is you have to meet certain weight-related requirements. And number three, you're going to have a comorbid condition or other medical conditions related to weight that are affecting your health. So based on your weight, your medical health, and your prescription drug coverage is what's going to make you eligible and qualify for this.
Sir, on the comorbid part, what things would qualify? High blood pressure, diabetic, that kind of stuff?
Yes, exactly. So sleep apnea is a common one, diabetes and pre-diabetes, heart disease, cardiac disease. Those are the main ones that are going to be quick treatments that will let them get onto this medication.
Perfect.
So there may be other lists as well, but for now, those are the ones that we're most familiar with. Okay, so now this is going to take us filling out some paperwork. So once we hear from our clients that they're interested in the medication, and we've confirmed that they meet the criteria based on their weight and their other diseases, then we're going to be submitting some paperwork, a prior authorization request. And again, this is going to open up next week, and we expect there's going to be a mad rush for a lot of people to get listed onto this to get their prior authorizations in.
And really quick, doctor, it might sound like a silly clarification, but I actually got 3 people asking me, can my mother or my daughter, can my daughter do the pre-authorization paperwork for me? Is there a website I can do the pre-authorization paperwork on? People just don't know that it must be done by a physician, obviously. So this is our opportunity as Vitality Weight Loss to be one of Nevada's, the only one I know of at least, qualification center where Dr. DeBry himself, our physician, will be doing the pre-authorization paperwork.
Okay, yes, and it's not complicated, but it does take a physician's signature there.
Now, can they get anything at all from their current doctor, or no? It has to go through whoever. So even a current doctor could do it, but it would be easier through you guys.
So absolutely any current doctor can do it.
Okay.
So we would never say like, oh, we're the only ones, but we're very comfortable and familiar with it. And so we're trying to make the process very smooth and very quick for our clients. And so, but other doctors, as they learn about it, will be able to do that as well.
So, and when they call you guys to have this done, do you know the time frame on submitting the paperwork and then actually being able to pick up the prescription?
So prescriptions will be available after July 1st. I don't anticipate that there will be a long lag between submitting it and having approval, but I guess time will tell. We'll see how the federal government does.
Okay. And any issues with regard to a certain plan that they're on? Any companies from WellCare to Humana, et cetera, that are not allowing it because it goes through Part D?
So I believe that most of these Medicare plans are going to fit in the category because for the Part D, it doesn't have to be a certain Part D. They just have to have the coverage. As you know, like Part D has multiple versions underneath it, and some of them are horrible. Some of them are very good. But in this case, it doesn't matter which version of Part D they had as long as medications are covered under it. So
Perfect.
I don't anticipate big problems there. And it's because one of the big issues is a lot of these Medicare Advantage plans try to shut people out and don't offer a lot of these more expensive programs. But in this case, I'm pretty sure that they're all going to be covering it because it's basically a Medicare expense, not a expense specifically for each plan.
Perfect. Yeah, I just had one of the carriers say, we are going to do it like other people wouldn't. So
Oh, interesting. Well, we will see.
thanks.
Okay, so our goal is to get as many people on the list as possible, especially people who are anxious to get on the medicines. And there's so many patients. I had one lady in my office like 2 months ago who was literally crying because she's so frustrated that she wanted weight loss. She has very, very low income. She can never afford $400 or $500 or $600. So my belief is that there's a lot of people out there in the community are going to fit into that same category. And when they start hearing about this, there's going to be a lot of interest. So being the first in line, being able to get that prior authorization in quickly is going to be able to get that started. The program runs through December of 2027, so it's a little over a year and a half to be able to get that started. But again, it takes you a while to ramp up on the medication. You start at a lower dose and gradually increase it. And so to really get the full benefit of this, we want people on it quickly. And of course, we don't charge for these services. Medicare has standard fee schedules related to visits. That's part of their regular Medicare. But for our eligibility check, we're doing that for free as a service to the community. Okay, so here is our QR codes for anyone who's interested. And we'll also have that available on our website for people who are interested in eligibility. So you can call us, you can go on our website, you can come to our office and start this process of getting your eligibility checked. Of course, we'll always double check your Medicare information, allergies, medications, other risks in a complete medical assessment. Okay. So trying to understand this. So we are not affiliated with, but we are a company that has Medicare providers. And also,
Doctor,
we are a company that's very familiar
can
with
you go
weight
back? I'm
loss.
sorry, because I think you were breaking up. So right when you started on the next slide, I think that's when you started breaking up. I'm sorry. Can you guys hear me?
Yes.
Okay, pardon me, guys. I think he jumped
I
on.
do.
He's probably gonna jump back on because he's in his office, and I think he was telling me his Wi-Fi was being low for a little bit. So also we'll give him a minute here to jump back on. And
Freddie,
while
does
he's
this affect anything if I already have a primary care doctor? Nothing I could tell my clients. I was going to send out a newsletter and I can put your number in there. They just call you direct. You take care of it. Do they have to come into your office and all of that?
I'm so sorry, Betty. What was that? One more time?
So even if I have another primary care doctor, you're basically a specialist and I can go in to see you guys to get this done. And can I do it over the phone or do I have to be in person?
No, first part of that is very interesting because we have doctors that actually prescribe GLPs themselves. They still send us referrals even before this happened. So they understand that we're specialists in this. And the fact of the matter is that a lot of people are on GLPs, right? But they don't know how to really live besides being on GLPs. So studies show that people on GLPs for 6 months lose 50 pounds, get off of GLPs, and gain 80 back.
Yeah,
Because
and I'm absolutely 100% and 150% want people on this. My question though is will it affect? So I always have to look up a doctor referral. So you guys would be considered a specialist if they come to see you?
is that correct, doctor?
We're just considered primary care.
So with all the HMO plans, your primary care doctor has to be certified with the carrier,
That's correct.
Alignment or Humana or United or etc. Are you guys certified with all of them?
For us to see a patient who was on, like, let's say Optum HMO, we would have to be a provider. We're not on some of those HMO plans, those Advantage plans, but we can still fill out the paperwork to get people on the list, and then we can work with our primary care doctors to help them. So we don't have to be their provider to get them on the list for the approval.
Okay, and then once it's approved, they have to switch to you, or they go back to their primary?
Not at all. Not at all.
Okay, so you guys are going to still maintain it and up it every month for me?
You're talking about the actual prescriptions and the like the medication guidance, you're saying, right?
Yes, the ongoing, yeah.
Yeah, that's a great question. Once people are approved and on the medicine, we'll have to see how that works. So that's kind of a to be determined aspect of this, I think.
Okay. What plans are you guys currently on? You're not on Optum. Are you on Intermountain, P3, Astrana, any of those doctor networks?
So we are on straight Medicare and on United Healthcare, and there's one other one that we're on. We're still working on some of those other ones you mentioned, and it's a struggle because
it is.
they have very limited providers. So
Cigna and Humana.
So yes, we have, but I don't think Cigna has a Medicare plan, but Humana.
No, they do. Cigna does have they call it Health Springs.
Oh, okay.
And it's a Medicare Advantage plan. Yeah.
Oh, excellent. Yes. So anyways, obviously our goal is to get on as many of those as we can. We are
But Humana and Alignment, you're not on yet.
Not yet.
Okay.
No. But we're working on those. But
Perfect.
Yeah, so as far as getting patients screened and getting them started, we can do that whether we're on their plan or not.
Got it. Okay.
Okay, sorry, back with you. Sorry, my wireless didn't make it through. Okay, okay, I guess that was the end of the slideshow, Freddie.
Awesome. Yeah, I wanted to emphasize another component of vitality weight loss, in that, again, as I was alluding to earlier, one thing is to be on the meds and to have a doctor prescribe it for you. Another component of this is what's really going to keep it sustainable, and that's why Vitality exists. As Doctor was saying earlier, we wanted to have a comprehensive weight loss center that includes GLP-1s when appropriate, but besides that, we also offer intensive behavioral therapy, behavioral counseling. We have registered dietitians and fitness coordinators. So we have a beautiful brand new facility at 6140 Brent Thurman. We're on the corner of Sunset and the 215, kind of right there by IKEA. And we have an actual fitness facility, lecture rooms. We have a nurse's office, and Dr. DeBry's office is there as well. And yours truly, I'm there all the time as well. And we'd like to. Right now, we're actually offering a lot of free services. So anyone can come by the office, not only to start their pre-authorization paperwork, but we offer a free in-body 570 scan. So with the in-body 570 scan, the scientific name for it is a bioelectrical impedance analyzer, and it's a special type of scale that you jump on it barefoot and you hold electrodes in your hands, and it sends electrical waves through your body, measuring distances and all kinds of scientific stuff through your cell structure, and it gives us over 30 pieces of your body analysis. So we'll know what your actual skeletal muscle is, your body fat, your visceral fat, which is very dangerous and very important to know, and so much more. Muscle segmentation throughout the limbs of your body, extracellular water retention, total body water, BMI, body mass index. So we have over 30 pieces of analysis of your body and how it's made, because no two bodies are the same. And then we've developed a software where we enter that specific information that's different for everyone. And we make a hyper-personalized workout plan and meal plan for people. And that's all a free service that we'd like to offer for our community. So even the brokers, if you guys are interested in it for yourselves, come on down to the office or go to our website and please click on free consult or schedule your in-body, and you'll meet me. You'll meet Anna, our fitness coordinator, and Delina. She's actually on right now as well. She's our marketing liaison. If you'd like more information on all this, please reach out to Delina, or just in the chat room, please just put in there, come visit me, and Delina will go ahead and email you and set up a time where she can go to your office with more literature if you'd like, with our QR codes, with some pass out material you can give to pass out to your clients as well and patients, and we'll be happy to help you. So again, all of this that we're offering, we're not asking anything for it. It's all a free service while we get everything started, and it's our pleasure to serve our community that way. Are there any questions?
No, but I'm on board, Freddie. I love that.
Awesome. I'm glad. Yeah. So Betty, if you want to come down, we're there Monday through Friday. I think this Saturday even Dr. DeBry's gonna be there for some free consults that we set him up with. So we're taking up all the Saturdays. I feel bad, but it's part of the game, I guess. And
Yep.
if you want to come by sometime next week or whenever, please just go on the website and let us know. And or if you would like Delina to come by and drop some more stuff off too, we'll be happy to do that too.
Awesome. Okay. Yeah. And I just don't want to, like I said, I'm working on a newsletter to get out to my clients about this because everybody's calling and knows about it. I just don't want it to be because a lot of these people do not have money for the extra stuff.
Hmm.
And a lot of them, like only 20% is actually supplements, which is original Medicare. And the rest are like HMOs, and the HMOs, you guys have to be on there. So, as soon as you do get on Humana and all that, let me know. But I work a lot with United. I just set 5 appointments today because they give me leads. So, I know those people can
Yeah.
with you guys.
And Doctor, I think we are with Humana, right?
We are
That's
with certain Humana plans. Yeah.
Okay.
To find out which ones are in the HMO category, though.
Yeah, and what I put under who's the doctor I certify in the system? You did Dr. DeBry?
DeBry. Yep, DeBry.
So if I put your name in, you pull up under United or whatever plan it would be for Humana.
Yes. Yep.
Okay. That way I know for sure you guys can continue with those people as, or even have them change for you to be their primary care or specialist, however,
Right.
you guys decide to do that. It just gives more opportunity for anybody that you're certified with. So I'll double check on the Humana plans and the United, just so that I don't send, and I can send everybody to you about it. It's just that I know a lot of them are going to be tight with money and aren't going to proceed
Right.
paying after, and then you're losing out on what you need to.
awesome. And Betty, I'll send you an email after this is done as well
Okay.
with a little bit more information. Because even if just for the sake of them knowing that there's a place where they can get help, whether or not they're on the whether they're or not they're on the insurance or not, you could put that in your newsletter,
Perfect.
and let them
Yes,
know
because
that
I
we're there
send
to
them
help
out
them
quite
too.
a bit. So it's nice to give them extra information when they're looking for other resources like being more fit and healthy.
Cool. And then I'll ask you where you're at too, and if it's okay, we'll have Delina go out and give you a visit and drop off some material for you.
Yeah, I'm not in my office a lot, and I'm in the middle of not having a house right before certifying for AEP, and I'm a mess. My house closed too soon, and I'm not in my new one's being redone, and I'm temporarily housing with someone who goes to New York every year.
Cool.
So, yeah, I don't really have an office to go to, but I can get out to you guys. I'm on that part
Awesome.
of town all the time.
Perfect. Okay. Yeah, man. We'll be in touch. Awesome.
I appreciate it. And you have got my email correct when I signed up.
Correct. Yeah, we have your. I looked at it right now and I got it. So I'll just email you as soon as we're done here. We'll email you a recording of this too, so you have it.
Okay.
And
I missed the beginning. I couldn't get a client off the phone, so thank you.
no problem. Yeah, we'll follow up on next steps afterwards.
Hi,
Okay.
Freddie.
Hi.
Hi, there's not a raise hand feature. Sorry about that. I won't keep you long. Hello, Dr. DeBry. My name is Ozella. I just wanted to thank you. I'm over at the Tyler Insurance Group. I have so many clients over the years that have seen you for surgery. And so, one, I just want to thank you sincerely for being a surgeon and a physician here in town that people
Oh, that
trust
makes
and
me
rely
happy.
on. It's wonderful. And I was so impressed when I received this invitation because I know about Vitality. I've had other clients that have told me about Vitality. And so I said, oh, I know this doctor. Let me hop on and see. Thank you so much for genuinely.
That makes me smile.
I
Thank you
mean
so
it
much.
sincerely. I know you're very pleasant and you act like you're not tired, but I know you work nonstop. And so I just appreciate you taking this time. And a lot of it goes to the testimony of how you're living your life and your personal life. So it's a good, sales pitch for people to realize, you can get ahead of your health and be well. So I just sincerely appreciate all you're doing
Right.
for our seniors and just for patients here in Vegas in general. Thank you.
Thank you,
Oh, thank you so
That
much.
was
Nice
awesome.
to hear that.
Oh, and Tessa, thank you. That's nice to know because I didn't know Dr. DeBry. So thank you it gives me more confidence when I'm referring, knowing that. So thank you.
Betty, yeah, I'm with the Tyler Insurance Group, and I think you might have heard of us. We do a lot of Medicare. And
Oh yeah, I'm
he's a
really
very,
familiar with you guys.
yeah, he's a very esteemed surgeon. So I was very pleased that he's doing this. He absolutely is.
Oh, nice. Thank you.
Awesome. Well, that said, Dr. DeBry, I want to say that I myself am honored to work for you. He's a great boss as well, guys. Thank you very much. And if we don't have any questions, I'd like to thank you all for jumping on and set you guys off and with a quick thank you and blessing. And I appreciate everyone's time. And we're always available. Email us, call us, text us, whatever works best. We look forward to hearing from everyone else. Anything else, Dr. DeBry?
Nope, that's a good summary. Thank you.
Awesome. Thank you all very much. Y'all have a good night. Thank you.
Thanks.
Thank you.